Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. 25% of the world's population is currently afflicted with fatty liver disease that's not caused by alcohol consumption. Now, excess alcohol consumption can certainly cause fatty liver problems and life-threatening cirrhosis, but people who don't drink alcohol or who drink very little alcohol can still develop a serious liver problem known as non-alcoholic steatohepatitis, or Nash, which has become a global problem in recent years. There's no doubt that this problem is tied to many global lifestyle trends such as the obesity epidemic, the high consumption of fatty foods, the high consumption of sugary foods, accompanied by reduced physical activity and exercise. Now, Nash, or non-alcoholic steatohepatitis, is a serious problem for people who have it because it can lead to liver dysfunction, cirrhosis, which is a life-threatening condition, and it increases the risk of primary liver cancer known as hepatocellular carcinoma, which is on the increase worldwide, largely due to the increase in fatty liver problems that we're seeing globally. So eating less high-fat animal foods and other fatty and fried foods is a good start to prevent and reverse early-stage Nash. But then the same thing applies to, sugary foods and getting more endurance and physical activity. These things all help to prevent and reverse early-stage non-alcoholic steatohepatitis. Some supplements have also been shown to be helpful in reversing Nash, such as vitamin E at 400 to 800 IUs a day, and other supplements that help to remove fat from the liver, such as lecithin, which contains choline, as well as a supplement known as trimethylglycine, or betaine. But in July of 2022, a study published in the journal Hepatology provided another important piece of the puzzle that appears to be significant in preventing and treating early-stage non-alcoholic steatohepatitis. The researchers discovered that people with a progressive form of non-alcoholic steatohepatitis have high blood levels of homocysteine. Now, when the homocysteine levels rise, the homocysteine damages certain enzymes in the liver and other structures in the liver cells, which facilitates more rapid progression to more serious liver dysfunction and cirrhosis in these cases. But researchers found that vitamin B12 and folic acid supplementation lower homocysteine into the ideal range, and they improve liver function in mice who previously had non-alcoholic steatohepatitis with high homocysteine levels. So the researchers used vitamin B12 and the other B vitamin, folic acid, because in normal human metabolism, these two vitamins work to lower homocysteine into the ideal range, including in liver cells, which results in lower homocysteine levels, and in the case of mice, it improved their liver function when they previously had fatty liver problems. The researchers conclude that vitamin B12 and folic acid supplementation can be considered a first-line therapy in the treatment of Nash, especially in patients with high homocysteine blood levels. So my advice is that everyone should have their liver enzymes checked annually by their doctor as part of a standard blood profile to see if they have non-alcoholic steatohepatitis. There's no symptoms in the early stages, but elevated liver enzymes show up on blood tests. If your liver enzymes are high, it's indicating that you have Nash. Then some follow-up blood work should also look at your homocysteine blood levels. If your homocysteine blood level is high, then part of the treatment should include vitamin B12 and folic acid supplementation to lower that homocysteine down into the ideal range. Elevated homocysteine level can also be a risk factor for heart attack, stroke, Alzheimer's disease, and it can make certain mental health problems worse as well. So it's really worth knowing your homocysteine blood level for a number of reasons. The good news is that if your homocysteine level is high, supplementation of B12 and folic acid can lower it into the ideal range in most cases. Studies indicate that about 5 to 30% of the population have elevated homocysteine levels. They're walking around with it. Most of the time they don't even know. That would be a blood level above 14 micromoles per liter. An excellent review of elevated homocysteine and its ties to cardiovascular disease and all-cause mortality appeared in 2015, which I've included in the references below. The typical dosage to lower high homocysteine levels is vitamin B12 between 1,000 and 5,000 micrograms a day, folic acid about 1,000 micrograms a day, as well as vitamin B6 at about 50 to 100 milligrams a day. So this non-alcoholic fatty liver problem is becoming very, very widespread. It's important to know if you might have it, and knowing that high homocysteine levels can make it worse. This is critically important information because B12 and folic acid can lower homocysteine in these cases and be part of the treatment. So I've included the references for this information in the text below. Thanks for watching, and I'll see you next time.